So we established, good efficacy, durability of response, and the side effect profile is pretty low. Now, in this trial, we also looked at a combination therapy, right? The way it was originally designed, we had three cohorts. We had cohort one with the Cetrelimab, and this was cohort two with the monotherapy with TAR-200 alone, and cohort three was Cetrelimab alone, just to see the contribution of components there and really tease out. And it turns out this one had the highest efficacy, right? So I I want to know your thoughts on what do you think about the combination therapy and why did we not see improved results with the combination of TAR-200 plus Cetrelimab, which is a PD-1 inhibitor?
Yeah, I'm glad you brought this up because unlike a lot of the other trials in this space, this was actually it started off as a randomized trial. So there were multiple arms, so there were three arms to this trial. And the big surprise we heard about in ESMO was that the combination arm actually did worse. And it was like a 67% response
Yeah.
rate. I think at least in my patients, I think it was just too much for patients to handle. I think it was basically due to, I think the citralimab um, caused patients to have a little bit more in the way of AEs, and they discontinued treatment. And I don't think they got as much TAR-200 treatment. Was that your experience as well?
Absolutely, 100%. I think that was the case. We have a lot of these combination trials now, right? Whether it's BCG plus PD-1 or PD-L1 inhibitors. Now we have these combination therapies, and I think you're right. First of all, the numbers were very small, so it's hard to make a real determination on the randomized study of comparisons to the monotherapy arm. But basically the AEs were much higher, and so probably not worth it. Once we started seeing the good results on the monotherapy alone, it really didn't make sense to try to get even better results from it. At the time, we went through all these interim analyses of 70%, 80%, and ended up with this 82% CR rate. So I think the addition of a systemic therapy in this setting just doesn't quite add up in terms of the balance between efficacy and side effect profile.
Yeah, and I think we were all kind of happy to see that because
Yeah,
we obviously we want to try to get these patients a good, a drug with good efficacy with the lowest amount of AE. So it's nice to see
exactly.
that they just needed the monotherapy.
Right, right. And then of course the Cetrelimab alone arm, we saw a 35%, CR rate, which we're used to seeing in the monotherapy arms with other trials as well.